Okay, so our next presentation is going to be from Dr. Ekenna, who we call OK. Dr. Ekenna, again, as I've mentioned with Dr. Roth, has been in the Single River Hospital system for decades. He has been the chief infectious disease person in the system during that time.
Good evening. I think Randy has said really what there is to say. What I was going to suggest is that I can talk about vaccines in general, but I would recommend that if there are questions from the audience about the vaccine, about the disease, and maybe we can actually address them, because I don't want to be discussing something that is superfluous, something that's not very important for you. So my suggestion is, if there are no questions, I can run through a few things, but I'd rather have, take questions on at this stage. Yes?
Could you expand on what may be the difference, if there's any difference between Johnson & Johnson and the Moderna and the Pfizer vaccines?
Good question. Let me repeat. He wants me to discuss the differences between the vaccines, and I think that's a very important question. I think that's actually a key question. In general, just for everybody, there are typically multiple different kinds of vaccines. The traditional vaccines, the ones we call conventional vaccines, are the ones that we are familiar with in old times. Usually what we call life attenuated. You get a virus, you treat it and make it weak, and then you use it to vaccinate people. That is traditional. Typically polio, MMR, measles, mumps, and rubella. That's the classic one we give to children. Then there's the ones we call inactivated. That is killed vaccines. Typical example would be flu, influenza, the one we get every year. Then there are the so-called subunit vaccines that could be called sometimes recombinant, polysaccharide, conjugate vaccines like pneumococcus, pneumonia vaccine, what we call pneumonia vaccines. We get those too. Those are the classic vaccines. And of course, there are things like toxoid, like the tetanus, which is essentially you take the toxin from the virus and use it as antigen. That's typically what it is. Now, your question, of course, is one of the things that is very important in this case, that these vaccines now are a little new. They are the DNA and RNA virus, vaccines. This one, the current COVID vaccine from Moderna and from Pfizer are so-called mRNA, messenger RNA vaccine. That's new. They are new because we haven't had anything like that is recent. But the method itself is old. They've been working on this since the 1990s. Essentially, messenger RNA is the type, part of the cell protein that basically translates proteins. It's really a protein that translates, it takes the antigen that we want, which is the spike protein, that thing's taken out on the virus, gets it into the cell, and the body sees it as a foreign body. It then makes antibodies to this, and that's typically what happens. The question he had about Moderna and Pfizer are from this mRNA, messenger RNA. Different from DNA, like Dr. Roth talked about. The other one, you talked about things like the Johnson & Johnson and, what's the other one now? AstraZeneca. Those are kind of vector vaccines in many ways. Vector in the sense that they are modified or killed, they have adenovirus or some type of virus that is not vicious on us that our body can handle. You put the protein in there as a gene, and then that vaccine now, the virus grows and makes produces these proteins which the body sees as foreign body and makes antibodies against them. So that's what it is. So they have their different advantages. The biggest advantage for the mRNA vaccine is that it is new, it's rapid. You guys remember the flu vaccine. It is difficult to grow enough eggs, have enough eggs to make vaccines for 7 billion people. So really, that would not have been a practical way. So that's the difference with this one. So this can be ratcheted up very quickly, and you can make vaccines like you realize now there are so-called viral strains that are different in South Africa, in England, in Brazil, or wherever. So you can take that portion again, put it in the RNA, and quickly generate, antibodies or new vaccines.